Welcome to our presentation about hyperthyroidism and delirium.
HD is a 38-year-old patient with psychiatric history. She's a non-smoker, no drug abuse, and there's no family history of psychiatric disorder. 4 months ago, HD was presented to the psychiatric emergency for depressive symptoms. She essentially presented a depressed mood, depressive thoughts of hopelessness, decline of social activities, speech, and body movements. However, there were no clinical or biological sign for a somatic disease. HD was brought to the psychiatric emergency for delirious hallucinatory symptoms. She had marked bilateral exophthalmos and hyperhidrosis, tremors of extremity, goiter, tachycardia, and vomiting. The normal parameters of T3 are between 70 to 210, and her results were 800. The normal parameters for T4 are between 0.7 to 12. Her results were 27. And the normal parameters for TSH are between 0.3 to 6.2, and her results are 0.002, which resulted in her diagnosis of hyperthyroidism and delirium.
Definitions. Delirium. Serious disturbance in mental abilities that result in confused thinking and reduced awareness of environment. It's considered a secondary condition of hyperthyroidism. Exophthalmos, presenting protruding, staring eyes and decreased blinking and eye movement. Hyperhidrosis, a condition associated with abnormal increased sweating. Hyperthyroidism, an overactive thyroid condition where your thyroid secretes an excess amount of T4 and T3. Goiter, it's an enlargement of the thyroid gland that can develop with both hyperthyroid and hyperthyroid conditions. Graves' disease, an example of hyperthyroidism. It's an autoimmune disorder manifested by signs of hypermetabolism, goiter, and exophthalmos. Prevalence of hyperthyroidism. In Canada, 1 in every 100 people will be affected, and 80% of thyroid cancer patients are women. In the US, it affects about 1.2% of the population, and worldwide, 0.4 per 1,000 women are affected, and 0.1 per 1,000 men. The age peak specific is between 24 to 69 years old. Prevalence of delirium, and in Canada, acute care is about 64%, and outside of acute care is less than 0.5%. In the US, more than 7 million of the population suffer from delirium, and worldwide, 1% of the population who is diagnosed with hyperthyroidism presents to be delirious.
Some clinical features of hyperthyroidism include a fast metabolism, sudden weight loss, depression, an enlarged thyroid gland, mood swings, nervousness, tremors, heat sensitivity, rapid or irregular heartbeat, and irritability. Clinical features of delirium include a reduced awareness of the environment. An example would be an inability to stay focused, easily distracted, appearing withdrawn. Cognitive impairment. An example would be impaired memory, disorientation, a hard time speaking or recalling words. Behavioral changes include hallucinations, restlessness, agitations, and disturbed sleep, and emotional disturbances, which include anxiety, fear, paranoia, depression, and irritability. Causes of hyperthyroidism include Graves' disease. It is an autoimmune disorder which antibodies produced by your immune system stimulate your thyroid to produce too much T4. It's the most common cause of hyperthyroidism. Normally, your immune system uses antibodies to help protect against viruses, bacteria, and other foreign substances that invade your body. In Graves' disease, however, the antibodies mistakenly attack your thyroid and occasionally attack the tissue behind your eyes and the skin, often in your lower legs or visions. Thyroiditis is when your thyroid gland is inflamed due to unknown reasons. Inflammation can cause excess thyroid hormone stored in the gland to leak in the bloodstream. Hyperfunctioning thyroid nodules occurs when one or more adenomas of your thyroid produce too much T4. An adenoma is a part of the gland that has walled itself off from the rest of the gland, forming non-cancerous lumps that may cause an enlargement of the thyroid. Other causes also include excess iodine, tumors of the ovaries and testes, and benign tumors of the thyroid or pituitary gland.
Pathophysiology of hyperthyroidism. The thyroid gland produces thyroxine and triiodothyronine. both which influence every cell in your body. They help regulate body temperature, heart rate, production of protein, and they maintain the rate at which your body uses fats and carbohydrates. The releasing rate of T4 and T3 are controlled by the pituitary gland and hypothalamus. The hypothalamus signals the pituitary gland to make hormones TSH, or a thyroid-stimulated hormone. It then releases the TSH, and the amount is dependent on how much T4 and T3 are in the blood. Too little T4 and T3 results in TSH rising. Too much results in TSH levels to fall. The most common cause of hyperthyroidism is an autoimmune disorder called Graves' disease. In this disorder, the body makes an antibody called thyroid-stimulating immunoglobulin, or TSI, that causes the thyroid gland to produce too much thyroid hormone.
Possible causes of delirium include drug toxicity, toxin exposure, malnutrition or dehydration, sleep deprivation, severe emotional distress, and there are also a combination of certain medications that may trigger delirium, which include sleep medication, medication for mood disorders such as depression, drugs for treating spasms and convulsions, electrolyte disturbances, and thyroid problems. Pathophysiology of delirium. There's many hypotheses that exist, including neurotransmitter abnormalities, inflammatory response with increased cytokines, changes in the blood-brain barrier permeability, widespread reduction of cerebral oxidative metabolism, and an increased activity of the hypothalamic pituitary adrenal axis. Tests and diagnosis of hyperthyroidism include a medical history, a physical exam in which the doctor looks for a slight tremor in the fingers when extended, overactive reflexes, eye changes, warm, moist skin. He will also examine the neck to see if it is enlarged, bumpy, or tender, and he will check the rate of pulse. Another test would be the blood test, and if it indicates hyperthyroidism, the following tests may be recommended, which include the radioiodine uptake test, thyroid scan to look for nodules, and an ultrasound. Tests and diagnosis of delirium include a family history of psychiatric condition, mental assessment status, where the physician will assess awareness, attention, and thinking, observation of neurological status, which include cognitive, sensation, and motor function, and the following tests may also be possible: blood and urine tests, EEG, and head CT scan and MRI.
Medical and surgical treatment of hyperthyroidism includes antithyroid medications, which reduces symptoms of hyperthyroidism by preventing your thyroid gland from producing excess amounts of hormones. Radioactive iodine is absorbed by your thyroid gland, where it causes the gland to shrink and symptoms to subside. Beta blockers treats high blood pressure. It reduces your heart rate and palpitations. Thyroidectomy surgery is involved to remove part or all of the thyroid gland. Medical and surgical treatment of delirium. One of the first goals of treatment is to address any underlying causes or triggers, like stopping use of medication. The next step is to make the environment suitable for the person's healing body and calming the brain. Medications are lorazepam, and it gives a calming effect in the brain. Thiamine, which for vitamin B deficiency, and other antipsychotic drugs.
In the ICF model, the structure that's affected is the thyroid gland. The impaired functions include tremor of bilateral extremities, palpitations, and increased heart rate. Activities include difficulty swallowing, slowed speech and body movements, unable to cook for her family, and difficulty driving her kids to school. Participation includes decreased social participation, difficulty performing occupation as a lawyer, and unable to attend her Starbucks dates.
Thank you for listening.